Before I get into the medications, I want to give a brief overview of hypertension, just discuss some of the clinical practice pearls that you might see associated with medication therapy and what guides that selection a little bit. So first off, complications and risks. So high blood pressure, the big things are heart attack and stroke. Also, from a cardiovascular standpoint, it can increase the risk of heart failure as well as aneurysms. Also, blood pressure can impact renal function, so it can worsen chronic kidney disease and can contribute to some vision issues as well. So obviously, it's going to be important to treat high blood pressure. I wouldn't expect you to, 100% memorize all the goals and that type of thing. I would say a good starting point is 140/90. With that said, we have gotten more and more aggressive typically. So 130/80 is ideal for most. There are a couple exceptions where we might want to go even lower, like less than 120 for systolic blood pressure. In patients with kidney failure or renal disease and that sort of thing. So again, that kind of target can vary a little bit. Everybody for sure ideally should be under 140/90. The one exception might be end of life high risk geriatric patients, where we might have a little more liberal goal there of maybe like 150/90, but 140/90 is you probably want most of your population to be under that. Ideally, we'd probably want less than 130/80, and that's especially true if we've got risk factors like heart attack and stroke and those type of things. Generally, the lower the better. Stage 1 hypertension, this is based upon kind of the most common blood pressure guidelines. Again, ideally, we'd want patients less than 130/80 in most situations. If you can't get them there, if they're a higher risk patient, you may be a little less aggressive and you may settle a little bit higher in that situation. Lifestyle modifications. This can be definitely an important piece of your role, educating on some of the things that can lower blood pressure that don't involve popping a pill. So the DASH diet, as well as reducing sodium intake, those are two proven ways to potentially reduce blood pressure. Alcohol reduction, weight loss, increasing physical activity, definitely all important lifestyle changes to address there. Smoking cessation, that's a huge one. Smoking is a huge risk factor for cardiovascular problems. Excessive caffeine for sure can cause some problems. And other blood pressure increasing medications. I'll mention a few of those coming up here. And then, stress reduction, those type of things. All good lifestyle changes that can help reduce blood pressure and hopefully help us reduce our medication burden. I've spent over a decade teaching pharmacology, and I hope you enjoy this review and find it helpful in your studies. You can get full ad-free access to the MedEd 101 Nursing Pharmacology Review course at meded101.com/nurse. In addition, you'll get nearly 20 hours of ad-free, on-demand video lessons, downloadable slides which you can study from, over 40 cheat sheets and study guides, and practice questions to assess what you know. Whether you're preparing for exams or building real-world confidence, this course is designed to teach you things that matter on the test and in practice. Help support me in my mission to provide free, high-quality pharmacology education. You can do that by going to meded101.com/nurse and checking out the MedEd 101 Nursing Pharmacology Review course. Clinical factors to consider, when we're thinking about kind of the goal blood pressure and what seems out of range and what doesn't, age and life expectancy, falls, if patients have had numerous falls and those falls are associated with, getting up, standing, getting lightheaded, having that orthostatic hypotension type of feeling. When we change positions from sitting to standing, for example, that's an important clinical factor for a nurse to help assess and identify. So when you're doing a falls root cause analysis, identifying the time of that fall and if it was in relation or shortly after they recently went from sitting to standing. That's an important thing to note there for sure. And then drug-induced hypertension, that's definitely something, I have a greater focus on as a clinical pharmacist. And then medical causes of hypertension, that's definitely something that our primary care provider is going to be looking at as well. All right, so from the drug side of things, there are quite a few medications that can contribute to high blood pressure. And so, if you're doing medication reconciliation and you happen to notice one of these and they also have high blood pressure, or maybe they're on 2, 3, 4 medications, definitely pay attention to that. You can help pick this up, help notify the provider and say, hey, they're taking, an NSAID, they're taking ibuprofen, 600 milligrams, 800 milligrams, 2, 3, 4 times a day. Like, hey, could that be contributing to their high blood pressure? Or they're taking, a stimulant for ADHD, and that's causing their blood pressure to go up. They were recently put on, prednisone or corticosteroid burst. Another good example of a situation where blood pressure might go up a little bit. Estrogen therapy has been associated with a little bit higher blood pressure. Rarely SNRIs, that's like venlafaxine or Effexor. They can do that. Erythropoietin stimulating agents. So those are drugs used to treat anemia, like Epogen. Those can raise blood pressure as well. And then on the medical side, things to pay attention to. Sleep apnea is definitely a common one. So if you know you kind of got that overweight patient, they tend to not sleep well at night, or they snore a lot, those type of things, they're reporting issues that way. Sleep apnea definitely should be assessed for and ruled out as a potential contributor to high blood pressure. Thyroid function, excessive thyroid function, that can lead to elevations in blood pressure. There's adrenal gland disorders. There's oncology type disorders affecting that adrenal gland. That can potentially lead to medical-induced hypertension. And then illicit drug use and addiction. Obviously, our stimulants, your methamphetamine, those type of things, they can definitely raise blood pressure. But also you can have withdrawal symptoms. Opioid withdrawal is a great example where blood pressure can actually go up as we're in opioid withdrawal. Struggling with nursing pharmacology? Would you like a resource you can put in your hands? You're not alone. If you want to understand medications instead of just memorizing them, check out the MedEd 101 Guide to Nursing Pharmacology on Amazon. Written by a board-certified clinical pharmacist, this book breaks down high-yield drug concepts, clinical pearls, and real-world examples that actually stick. Perfect for exams and the bedside. Whether you're in nursing school or already practicing, this guide helps you build confidence with medications fast. You can find a direct link to the 233-page book right now at meded101.com/nurse. That's meded101.com/nurse.